Hi and welcome to Medicine, Past, Present and Future. My name's Dr. Nick and I'm the past.
And my name's Dr. Isabelle and I'm the future.
And together, we're the present. Now, Dr. Isabelle, question for you. What do rats, mouldy hay and blood clots have in common?
Well, for once I actually know the answer to this, Dr. Nick. Wasn't warfarin the blood thinner derived from a product from mouldy hay, initially used to kill rats before it was used in humans?
Absolutely right, Dr. Isabelle. It was back in the 1920s that someone noticed that cattle and sheep that fed on mouldy hay were dying of a bleeding disorder. And it took some clever scientists over 10 years to isolate the compound and then refine it to produce what today we know as warfarin.
Which, as you said, was initially used to kill rats.
Yes, sorry, rats. But it actually wasn't even that good because although it thinned their blood, it was really slow to kill them. So the scientists thought, well, maybe it would be good to treat clots in humans. And one of the first people to be treated was actually US President Dwight Eisenhower in 1955 when he suffered a major heart attack. So, Dr. Isabelle, tell us about blood clots. How do they form?
Well, it's a very, very complicated process, Dr. Nick. But essentially, normally clots start with some damage to a blood vessel itself. That causes what are known as platelets, tiny blood products, to come and clump together, which then forms this cascade of chemical reaction, which forms a big clot to actually plug the gap.
And the whole stack of known risk factors, and some of the most important are things like smoking, high cholesterol, recent major surgery, and cancer of any kind. And there are also people who have a genetic tendency for their blood to clot or cause DVT. DVT. Now, Dr. Isabelle, explain DVT.
So a clot in the body is known as a thrombus, and when that clot forms in the deep vessels, normally in the legs themselves, it's known as a deep vein thrombosis. Now, these aren't new, Dr. Nick, so what did people used to think caused them?
Now, well, back in the Renaissance times, the physicians thought it was a collection of evil humours in the legs, or even that a breastfeeding woman with too much breast milk, it would somehow leak down through her body and collect in her legs, causing blood clots.
Now, pregnancy is a risk factor for DVT, but it's nothing to do with that. Fortunately, there are some simple things we can do to reduce the risk, and one of them is keeping mobile and wearing compression socks. Why is that, Dr. Nick?
Yeah, this is really, really important because sitting still is a major risk factor. And it's not just long-haul flights. It can even be sitting on long train or bus journeys or sitting in front of your computer screen all day long.
So if you do get a clot, first of all, what can happen? And secondly, what can be done about it?
Yeah, well, funnily enough, small clots don't actually matter that much. But when they're big and in the leg, they can cause pain, they can cause swelling. And if a bit breaks off, it can fly up into the lungs. And that's where it causes cough, pain, shortness of breath.
Or even death.
Yeah, I was going to mention that.
So let's get all doctory and talk about treatment. What can we take to reduce our risk of clots?
So now we're talking about the so-called blood thinners. And they're basically two types. They're the antiplatelet drugs like aspirin and then full-on anticoagulants. And Dr. Isabelle, you're much more up with all this fancy physiology than I am. So perhaps you can explain to us, how does aspirin actually work?
So remember I was talking about those platelets, those little blood products before? In very, very simple terms, aspirin makes platelets less sticky, which means they're less likely to clump together. Now, question for you, Dr. Nick. If you were going on a long-haul flight and you wanted to prevent your risk of DVT, would you take aspirin?
It's actually a really good question, that one. Now, aspirin is very good at stopping blood clots in the arteries, but not so great in the veins. So no, we don't recommend aspirin before getting on a long flight.
And no one wants to be on rat poison long-term if they don't have to be. So there are a few things you can do to help reduce your risk of DVT. That's things like stopping smoking, keeping your cholesterol under control, and if you notice that one of your legs is a bit redder, sorer or larger than the others, have a chat with your GP.